Welcome to the Healthy Aging Pod. I'm Kelly Yee. You can follow me on Instagram at Kelly Yee Yoga or subscribe to my YouTube channel at Avatar Yoga. In partnership with EPC Canada, we are excited to bring you our Healthy Aging webcast series.
Our guest today is Dr. Catherine Multari, a licensed naturopathic physician and naturopathic oncology resident practicing out of Port Moody Health, Integrative Medicine, and Cancer Care. Dr. Multari is currently a member of the Oncology Association of Naturopathic Physicians and an active member on their research committee. In addition to being a varsity athlete in rowing, she was recognized as an outstanding and emerging leader who demonstrated exemplary skills in supporting the naturopathic medical profession and was awarded the Naturopathic Honor Award and NMSA President's Award. She is currently a licensed naturopathic physician in the province of British Columbia, specializing in integrative cancer care. Hello, Dr. Multari. How are you? How was your weekend?
I'm well, Kelly. How about yourself?
Very well. Yeah, I had a good weekend, which was nice. It was pretty relaxing, so it was good.
I took advantage of the nice weather and went for a bike ride up Mount Seymour, which I think will be the last one of the season because it was very cold.
Beautiful. And yes, the temperatures really dropped, so. All right, well, let's just dive right in here to a conversation. Can you tell us what is naturopathic medicine?
Great question. So naturopathic medicine, the word medicine gives half of it away. It's a type of medicine, one that's derived in naturopathic philosophies. So what naturopathic philosophies are, there's generally 6 principles that make up naturopathic medicine. And I find these guiding principles are a good way for a patient to understand exactly what naturopathic medicine is. So the first principle is first, do no harm. Most professions have that. And then principles 2 to 6 is where we get into the bulk of what we really do. So the second principle of naturopathic medicine is using the healing power of nature. So our philosophies are rooted in the fact that nature has such healing properties to it and using that to the best of our abilities. And then the third principle is identifying and treating the root cause. The fourth one is doctor as teacher. The fifth one is treating the whole person, so mental, spiritual, emotional, as well as physical. And then the sixth one is prevention. So those are the principles, but how does it look in terms of how naturopathic medicine is conducted? So for how naturopathic medicine is conducted, generally the first visit with a patient is anywhere from 60 to 90 minutes. And the reason it's so lengthy is so that we can hit on all of those 6 principles so that we can identify and treat the cause. So if you look at the conventional model where we have 15, 30 minutes for an initial consult, we're very focused on the symptom, which might be a headache, for instance. But if a patient with persistent and chronic headaches came to a naturopathic doctor, we would use that time to identify and treat the cause, educate our patient, use our role as teaching. For instance, if the patient is having a headache caused by dehydration, using that educational role to teach the patient why they may be having the headache, treating the whole person, so also identifying psychological triggers that might be making the headache worse, utilizing the power of nature, just meaning using natural interventions first before pharmaceutical, and then prevention. So how do we prevent that? So the headache example is a good example of how we use all 6 principles to treat patients and it well demonstrates what naturopathic medicine is.
Okay, that sounds amazing. That definitely sounds very patient-centric, which it's great. Would you describe this as like a complementary or an alternative to Western medicine?
Generally, I like to treat our work as complementary, especially in the fact that naturopathic doctors do use pharmaceuticals and prescription medication. So in that sense, I think that we even use Western medicine as part of our work that we do. It's not our first choice. But if something's serious enough at presentation, we might use it right away. So the fact that we do prescribing in itself is more of a complementary role as opposed to an alternative.
I really think that's important that you mentioned that, because I think this is also where some people, we, like those of us in the general public, we get a little confused as to, naturopathic medicine. And now my understanding, of course, is that, you go through, extensive schooling, and you take the same education up until a certain point when you decide to specialize into naturopathic medicine, the same way that a traditional physician would. Is this correct?
Yeah, that's a great point of clarification. So we do, like, up until medical school, patients who enter naturopathic medical school are required to have done an undergraduate degree and have certain biomedical sciences and certain academic standing to get into naturopathic medical school. And then the naturopathic medical school is 4 years, which is the same length as traditional medical school.
Okay. All right. And I love that, I think another thing that a lot of us don't really understand is, like, you aim to take this sort of natural path, but then you do have, because you're a physician and you guys are governed, the you have the ability to write prescriptions if need be.
Yeah, most naturopathic doctors have the additional training in prescribing, and any naturopathic doctor who can can prescribe medication, which is most, have done additional training and examination in pharmaceuticals, and that exam is actually run by pharmacists and is a pretty hefty, intensive curriculum as well as examination.
Okay. Thank you for sharing that information. And so, as a naturopathic physician, can you describe for us what general naturopathic doctors, naturopathic physicians provide to patients?
So, in the province of British Columbia, naturopathic physicians truly have the ability to provide the vast majority of primary care, meaning care that you would normally and naturally go to your family doctor for. So, naturopathic doctors can prescribe standard blood work. We can do screening exams such as of course, full body physical exams, listening to the heart, the lungs, also screening exams, doing clinical breast exams, digital rectal exams, pap smears, screening for cervical cancer, and prescribe the common medications that you would think of. So we can prescribe for diabetes, anti-diabetic medication, antihypertensive medication for high blood pressure, things for acid reflux, and so on. So naturopathic physicians in BC, because of our licensure, and because we have a wide scope and prescribing rights, we really can provide care to most patients. With that being said, I would say that in general, most naturopathic doctors tend to focus on the areas that are not as well addressed in the general system. So some of those areas may be bloating and digestive issues because, say, a patient doesn't have Crohn's disease or ulcerative colitis or a very intense bowel disease, but they still have bloating every day. There's not really a medication that can help with that. So naturopathic doctors do a great job dealing with bloating, digestive issues, as well as women's health, because almost every woman's health issue, the pharmaceutical for that is birth control, but not everybody wants to be on birth control to manage their endometriosis or heavy periods, acne, you name it. So yeah, digestive health, women's health, you'll see naturopathic doctors tend to focus in areas like that, but some as well do general medicine or other specialties.
And that's how I ended up seeing a naturopathic doctor, because I had myself digestion and gut issues. So, and I definitely have to say I found it, very, very helpful, because like you said, you guys do this sort of extensive diagnosis, and that's what I valued the most, because it was like a learning, like I learned so much from the naturopathic physician just about my own body and the issues that I was facing. So yeah, I very much appreciated that. It wasn't masking the symptoms, it was actually getting to the root of the problem, and now I'm able to essentially manage it. So yes, so I'm very appreciative of naturopathic medicine altogether.
That's fantastic.
So I understand you are currently a resident in cancer with an oncologist. So what type of care do you offer to cancer patients?
Hmm. Um, yeah, so currently I'm completing a 2-year residency in naturopathic oncology. And with this, the reason I pursued a residency is because I knew if I wanted to work with cancer patients straight out of medical school, I would require a lot more mentorship and training and didactic learning. So that is kind of what pushed me into completing a residency. And through the residency, you learn a lot about the therapies that we do offer cancer patients. So some of those therapies, they are all complementary therapies. So patients are still undergoing their chemo, radiation, surgeries. But as you know, chemo comes with quite harsh side effects, as does radiation therapy and extensive surgeries. So naturopathic doctors, and specifically naturopathic doctors who work in the cancer field, we focus on providing care for patients during the time of their diagnosis, through their active treatment, post active treatment, and then through survivorship. So some of these therapies include intravenous therapy. So when we do therapies through the central and peripheral nervous system, circulatory system, we bypass the gut. So doing IV therapy can allow for full absorption of these nutrients. So one example is high dose IV vitamin C. So vitamin C, we commonly know we use this in low doses orally to help our immune system, right? So we might have 1 to 2 grams of vitamin C by mouth to help our immune system. You can't really have more than 4 or 5 grams of vitamin C by mouth, because then that can create diarrhea. It brings water into the colon. So the way we get high dose of vitamin C into a patient is through their veins intravenously. And high dose vitamin C is usually above 20 grams. And so you think you usually have 1 to 2. We're giving 20, 30, 40, 50 grams. This has a very different effect in the body. It's no longer an antioxidant, it's more a pro-oxidant. So one that works synergistically with chemotherapy, and one that cancer cells can't survive those high doses of vitamin C, whereas your healthy cells can. So it creates a favorable environment where the cancer cells are less likely to thrive and your healthy cells are still maintained. So that's kind of one of our mainstay treatments, although we do other intravenous therapies, as well as something that is commonly used in Germany. It's called locoregional hyperthermia, heat treatment.
That sounds interesting. And these like different treatments and therapies that you offer to cancer patients, these are all evidence-based, right? Like they're researched and evidence-based.
Yes, they are. So all of the IV therapies we do with cancer patients have clinical trials on them. So there are trials of patients, so human studies, patients who are simultaneously undergoing chemotherapy and having intravenous vitamin C at the same time. So we're able to use the studies that are done in humans using IVs at the same time as the chemotherapy, to make sure the chemotherapy is just as effective, the vitamin C is safe, and we're getting favorable results. Same with the hyperthermia. There's studies on humans in specific types of cancers, and they show the outcomes of the patients who are on hyperthermia with their, say, radiation versus patients who are doing radiation alone. And we see favorable responses in the complementary arms of the studies. So they are all based off of human clinical trials.
That's so interesting. I mean, I love research, and I just think this is, wonderful that we're looking at different options and like utilizing, I guess, natural vitamins or whatever it is that we are actually researching. Because, as we know, when people have cancer, it's very scary for people to hear, and then it's quite prevalent, right, in our world. And to have different options that we are doing more research and better research, and they'll feel more confident to actually try it. I mean, I know people that, you get to a point where you're just like, you're willing to try anything, but it's great to know that, patients do have an option as well to go to see someone like you that, can provide them with things that's going to make them feel a little more comfortable. Hopefully, just make their life, their quality of life a little better during the treatment or therapy that they're going through.
Yeah, I think that's so important. And that touches on another point. I was kind of talking about high dose vitamin C and hyperthermia to improve outcomes, but the quality of life picture is an equally important aspect that we focus on when working with cancer patients, because quality of life is something that can't be overlooked. And one example is, for instance, if a patient is undergoing chemotherapy and they're scheduled to have 6 cycles of the treatment, and after cycle 3, their white blood cells drop so low, then the oncologist might postpone treatment. So not only is treatment delayed, but you can imagine somebody who has really low white blood cells would also have low red blood cells and is anemic and not feeling well. So keeping the patient's vitality and looking at their health and keeping their health as optimal as possible through all the treatments is just as important as optimizing the killing of the cancer cells. Because if we can keep patients healthy, they feel better and quality of life is preserved, and then their treatment also stays on course. So we do our best to allow the medical oncologists to do their job and be able to stick to their proposed treatment schedule.
So beyond what we were just talking about, basically you've already answered my question, but my question was like, why would a patient, or why should a patient, especially a cancer patient specifically, see a naturopathic physician like yourself? But, you kind of answered that. I mean, if you want to respond more to that, I think it's really fascinating as to, the what you're doing. Like I said, the research that's out there. I don't think a lot of patients know that this is an option.
Yeah, that's a good point. The patients have to do their own research to know what options exist, but there are options out there, and there are treatments that can help preserve the quality of life. And the importance of seeing, I think if a cancer patient is seeing a naturopathic doctor, it's important that they work with somebody who has a focus, or has some extra training in the cancer field, because not everything is safe when used in combination with chemotherapy and radiation, as well as drugs that cancer patients are on, hormone blockers. There's some interactions, even herbal interactions, that we have to be cautious about. And that's so myself undergoing the 2-year residency, and any residency trained naturopathic doctor who's done a residency in oncology will have extra training in the safety around naturopathic care and cancer patients. So when somebody's looking for an ND, making sure that they have the additional training in the cancer realm is super important to make sure everything they're doing is safe.
So when would you say that someone who has been diagnosed with cancer or is maybe undergoing treatment, when is the best time for someone to connect with you?
I oftentimes say the best time for a patient to connect is as soon as they know of their diagnosis. And the reason being is, as much as we are naturopathic doctors and help kind of mitigate treatment side effects and improve outcomes undergoing chemotherapy, radiation, we also serve as a fresh set of eyes. So some patients may have been assigned to an oncologist that they just don't feel super comfortable around, or they feel rushed into chemo, or they feel rushed into surgery, or whatever, you name it, because having a cancer diagnosis is very overwhelming. So I find seeing a naturopathic doctor at the time of diagnosis is very helpful, because generally 9 times out of 10, we're kind of just reassuring the patient that the proposed plan is the right one. But it really helps from a patient perspective is hearing that reassurance from somebody who's not invested in the therapies at all, like by a doctor who's not prescribing the chemo or radiation or surgery. So getting that reassurance, because as much as we're trained on the naturopathic therapies, part of that training is being trained on the conventional therapies and the appropriate protocols and clinical management of patients. So the time of diagnosis is really the best time for a patient to see a naturopathic doctor, to get that reassurance that the plan they're on is the right one. And then also, if they're about to go into surgery, even if they're just about to get a biopsy, it's important to have post-surgical support so that they heal better, have less chance of complications. So there's definitely pre and post-surgical naturopathic support within reason. Of course, we want to be stopping all medications and supplements prior and after surgery, but you can still prep the patient for the surgery. And then there's different therapies based on interactions and avoiding the pertinent interactions, whether somebody's undergoing chemo or radiation. And then care really extends into survivorship and prevention of recurrence. That's a huge one. So I would say the best time to start is right at the beginning, but there's really a role for naturopathic medicine in all stages.
Yeah, prevention is a whole other topic that we could even talk about. But, sticking to, if someone was diagnosed with cancer, do you work with the oncologists?
Yeah, so generally we always work with the oncologist, and we tell the patient it's really important for us to have a good working relationship with their provider, so that all parties feel comfortable, because it's very challenging to work. It's very challenging for the patient, I should say, when they have providers telling them two different things. It's very confusing and very challenging. So the best thing is to have all both the patient and their family and their supporters and both providers, like the whole team, on the same page. So we generally send letters to the oncologist with our consult notes and our treatment recommendations, so that it's transparent. What we're doing is safe and going to help the patient.
So, as you know, so I am a yoga instructor as well, and I have many clients that have are living with cancer, right? Like, they're cancer survivors. Some have undergone treatment, and they'd be one of my students' clients. And as a physician yourself, do you tend to collaborate with other providers, like whether it's a yoga instructor, acupuncturist, or any other sort of healthcare provider? Because it is a form of, like, their treatment or therapy or ongoing. Like, I know some people sort of see yoga as maybe just exercise, but there's so much more to it. But it is a form of, for many of my clients, they'll tell me that they use it for therapy, because both from the mental standpoint and, of course, physical, and then the spiritual aspect too, and then emotional regulation, right? So, but yeah, as for you, I was just wondering, do you collaborate with different providers?
Yeah, so the collaboration does go beyond just the oncologist. And what you mentioned about yoga is very true. The research on yoga is fantastic for yoga, for pretty much any chronic any chronic disease, in yoga research, like the arms that undergo the yoga as the treatment do fantastic. So that just goes to show, you're right, it's more than just exercise, because you see that group and that treatment outperforming like people who do just exercise. The mental, emotional, spiritual aspect definitely plays a role in healing. The mechanism of action is unclear, which is why the Western world has sometimes challenges with it. But I don't have a challenge. I don't have any problems with it when it works, and the research shows that it works. And so that's kind of the perspective I take. And so other healthcare providers that I tend to refer to commonly, I do work with personal trainers. I find this is a great one for all types of patients that I see, because generally patients I see, whether they have cancer or another illness, chronic illness, generally it's really tough to just tell the person to go exercise, because they may have physical limitations and really need a personalized approach. So I work with personal trainers, and I communicate with them directly about the patient's history and kind of what they have the resilience and physical reserves for. So I work closely with them, and then I actually do acupuncture myself. But when I can't, then I refer out, or when I can't, meaning when it's not necessarily convenient for the patient, because I work in Port Moody, say they live in Vancouver, then I refer out, and I commonly communicate with acupuncturists, and am always, always, always an advocate for yoga.
Thank you. And you know, I agree. I think there is great research out there. I'm still trying to push on getting more research out, and I think that there's just so much more for us to explore in that field. And I'm sure the same thing with even in your field, right? There's just so much more research we need to explore. It takes so much time, and as you know, with like clinical trials, such a lengthy process. So yeah, I definitely, you know, I just, me personally, in my experience of having clients that so many have, you know, won't even know until later that they have cancer. And then they'll tell me, I'm seeing them all the time, and they start to get comfortable with me, and they start telling me more about their ailments, even though I do ask for intake forms, but they will share what they feel they necessary to share. Not always do people feel like they need to share something that maybe they dealt with, like, you know, 10 years ago. But for me as a teacher, it's actually really important for me to know what their history is as well, because it does help in as we're going into the practice, and especially more if I do one-on-one with my clients. So yeah, I do very much appreciate this information that you brought forward. It's so valuable. I know that I could talk to you more about, you know, types of research you're doing, and maybe that'll be the next one that we do, because I would love to talk to you more on like different sort of, maybe even discussions on like if you have an example of case studies. But before we get there, or if you want to go into one of those, have you always wanted to be a doctor?
Yes, this is my favorite question thus far. It's because it's an absolute calling for me. Like it's my spark. It's a fire deep inside of me. So I always wanted to be a doctor since I can remember. I had my backup plans. I was thinking if I wasn't a doctor, I would be an engineer or a pilot, but those were always backup plans to medicine. And then it wasn't until my undergraduate degree, when I was in health sciences and kinesiology, learning more about the human body to prepare myself for medical school, did I get treated quite well with physiotherapists, sports psychologists, nutritionists, and they were all focused on having us athletes be the top of our game. And throughout that experience, I just learned a lot about health, and how health can come in different forms other than just pharmaceuticals. Health can come in the form of exercise, in the form of nutrition, in the form of plants and nutraceuticals, nature medicine. And then I thought, why is this type of health and this only provided to athletes? Like, this should be the type of health provided to everyone. So at that point, I thought I was going to be this really cool doctor who focused on lifestyle and natural means before pharmaceuticals, and essentially the whole description of a naturopathic doctor. Doctor as teacher, I really love education and teaching, and was a little bit humbled when one of my friends asked me, Catherine, have you thought about naturopathic medicine? And realized there was this whole profession out there for that. So I always knew I wanted to be a doctor. I didn't know it was naturopathic medicine, but I found that out um, throughout my 20s, and then pursued naturopathic medicine to naturopathic medical school. And at that time, I found my true calling. I always knew that I was meant to be here to help a very in need population. I just didn't know what that population was. And throughout school, I was introduced to naturopathic oncology and the role that naturopathic medicine has in cancer care, and that fuels a very large fire inside of me.
I love that story. Practitioners like you that can actually help people do that, especially if they're undergoing treatment, therapies, or like you said, even preventative stuff, so that it doesn't come back again, or at least taking different options and trying to do the best we can to live the best life possible.
Absolutely. I love that. And you hit the nail on the head. Everyone is living longer, but does have chronic health conditions we haven't seen before, the diabetes, the high blood pressure, chronic illnesses, including cancer, many, many cancer survivors out there. So exactly. How can we live this long life that we are all living thanks to the technologies and advancements of Western medicine is why we're living longer. And how can we combine that with possibly even some non-Western perspectives, some yoga, mindfulness, meditation, naturopathic medicine, holistic healthcare to increase that quality of life.
Absolutely. Thank you so much, Catherine, for doing this. And it's been such a pleasure meeting you and speaking with you. I wish you a absolutely fabulous day.
My pleasure. Thank you, Kelly.
Thank you.